BHN has helped operationally by freeing up the physician's time, as well as letting us use our facilities in a better, more efficient way.
Well, I think any practice that deals with women health care, or any ObGyn practice, or any practice that's doing gynecology would benefit from BHN. I think and again, we were in a different evolution with our practice because we were already doing urodynamic testing and treatment for incontinence and some pelvic floor work prior to bringing the service in. And I think a lot of docs are doing some of it, but I think what stops us from getting more involved is, number one, time, the capital expense to do this, and also making sure you're getting reliable data to make clinical decisions on, and BHN provides you with all those things.
It is a women's healthcare practice, and currently we have 8 physicians on staff and 4 nurse midwives and 3 nurse practitioners.
Anytime a patient either calls in or mentions during an appointment classic symptoms of leaking urine or leaking with an urge or stress, incontinence, complaining of frequency or urgency, which is usually an overactive bladder symptom, we would evaluate them in the office and then set them up for urodynamics to more clearly elicit what's going on.
So anybody who has the complaint of incontinence who desires treatment for it, I am encouraging to get urodynamics. I definitely would not perform a surgery on anybody for stress incontinence or prolapse without having that data, because I think you have potential of doing harm.
I do ask at the regular annual appointments any problems with leaking or urinary habits. And then lastly, we have a questionnaire of 10 questions that addresses symptoms of frequency, urgency, leaking, and prolapse.
We've really made a commitment, and probably, I think, since we incorporated Bladder Health Network, even more so with educating our providers and our staff. We now have our staff asking that questions. Are you having any problems with urinating or any pressure feeling? So we have a questionnaire that the staff goes through. We have a questionnaire that we hand out to patients. And I think our providers are much more sensitive about asking the question.
We decided to use a service model for the urodynamics mainly because of time.
It was taking up at least a half day a week of my time to perform that myself, and we were having to schedule out much too far, and we realized it was an inefficient use of our time.
So to be more efficient, we needed to come up with a way to free up our docs' times, getting them a way of doing the actual testing and spending more time with patients, going over results, alternative treatments, and performing those treatments, i.e. the surgeries. Well, I think our biggest concerns about bringing in an outside service to do testing that we're primarily doing with our physicians is how our patients would react.
And also just how good the quality of the test would be by being done by a third person.
I wasn't concerned as far as the business aspect of it. I had talked to many managers that were currently using the service, and so I knew that it made business sense.
So I think the patient reaction was number one. Number two was quality. Were we going to get the same data that we were getting from our providers doing it? And then thirdly, financially. I mean, we do, part of, it's a practice, it's a healthcare business, but we also have a financial responsibility. So the question is financially, did it make sense as a third component to that? And actually, as it turns out, all three have been very positive.
When we were looking at BHN, we looked at the financials, what we were, our cost at the current time, and then what our cost would be with Bladder Health Network, as well as the revenues that we would receive from those services.
The first thing we did was talk to the docs that were actually running the program, interpreting the data, what their background was, what their philosophy was, and was very impressed with those conversations.
BHN has been a great help with our office as far as helping with freeing up the physician's time. The physician now can be in the office seeing patients or be in surgery, and BHN will provide the urodynamic services for us.
BHN helps a great deal in drafting the treatment plans because the reports are such a detailed analysis of the urodynamics. I'm able to go through the 2-page summary, pick out the points that pertain to that patient, and come up with my plan. The biggest recommendation I have is to give it a try. I think any hesitations or concerns people have are legitimate, but once you give it a try and see the detailed reports, the satisfaction the patients have with the trained nurses that come in and perform them, and the results you get and the time that is freed up from that, they'd be very pleased.
So if anybody wants to grow their business, I think this is a great way to grow the business.
It's all here, all with BHN. Learn how BHN's solutions can fit into your practice. Call us today or go online.